The year is 1346. A farmer outside a small English village has just been thrown from his cart. His leg is badly gashed, a deep wound running from knee to ankle. Blood soaks through his woolen clothing. There is no ambulance coming, no emergency room waiting, no sterile bandages, no antibiotics, no tetanus shot. His wife runs to the local healer, an elderly woman who has spent 40 years learning which plants stop bleeding, which roots prevent wounds from rotting, which leaves draw out infection before it spreads. Within an hour, the wound is cleaned with wine, packed with a paste of yarrow, honey, and crushed plantain leaves, bound tightly with clean linen. The farmer is given an infusion of willow bark for pain and told to rest. 6 weeks later, he walks again. The wound has closed cleanly. No infection, no lasting damage, no chronic pain following him for years. Now consider a modern equivalent. A construction worker in 2024 suffers a similar gash. He's rushed to a hospital. The wound is cleaned with saline, stitched closed, bandaged with sterile gauze. He receives antibiotics to prevent infection, painkillers to manage discomfort, anti-inflammatory drugs to reduce swelling. He follows every instruction perfectly. Yet 3 months later, the wound site still aches. Scar tissue has formed incorrectly. There's lingering stiffness he can't explain. His doctor says it's normal, that some injuries just take time, that he might need physical therapy, perhaps more medication. He heals, but he never fully recovers. Welcome to the medieval advantage. I'm glad you're here. On this channel, we explore what our ancestors understood about health, resilience, and survival. Knowledge that modern science often overlooks or has forgotten entirely. Not because the past was perfect, but because some things were lost along the way that we desperately need to reclaim. Today, we're examining something that challenges nearly everything you've been taught about medical progress. Why did medieval herbal medicine often produce complete, lasting healing, while modern pharmaceutical approaches frequently leave us with chronic issues, incomplete recovery, and lifelong dependencies? This is not about rejecting modern medicine. Emergency surgery saves lives. Antibiotics have prevented countless deaths from bacterial infection. Modern diagnostics can identify problems our ancestors never knew existed, but something crucial has been lost in the transition, and the evidence is hiding in plain sight. Here's what might surprise you. Archaeological studies of medieval skeletal remains show something unexpected: wounds that healed cleanly, bones that set properly and stayed strong, infection rates that, in certain contexts, were lower than researchers anticipated. A 2015 study published in the journal Scientific Reports examined a medieval remedy for eye infections found in a 9th century Anglo-Saxon medical text called Bald's Leech Book. Researchers recreated the remedy exactly as described, using garlic, onion, wine, and bile salts. They tested it against modern antibiotic-resistant bacteria, including MRSA. The results shocked the scientific community. The medieval remedy killed up to 90% of MRSA bacteria in laboratory conditions. It outperformed many modern treatments designed specifically to combat these superbugs. This wasn't luck. This wasn't coincidence. Medieval healers didn't understand microbiology. They couldn't see bacteria under microscopes. They had no germ theory of disease, but they had something equally valuable: centuries of accumulated observation, recipes refined through trial and error across generations, survival pressure that eliminated treatments which didn't work because patients who received bad treatment simply died and those remedies disappeared. What remained was a body of practical knowledge that actually healed people. Let's address the assumption you've probably carried your entire life. Medieval medicine was ignorant. It was dirty. It was based on superstition and religious nonsense. People died constantly from minor injuries because they didn't know any better. This is the story we've been told, and it's largely wrong. Yes, medieval medical theory included concepts we now consider incorrect. The four humours: astrological influences on health, beliefs about spirits and divine punishment. But the practical application of herbal medicine operated on a completely different level. Medieval healers were empiricists before that word existed. They tested remedies on actual patients. They observed what happened. They adjusted their approach based on outcomes. They passed down what worked and abandoned what didn't. This wasn't random guessing. This was survival-driven science conducted over hundreds of years. A monastery healer in the 12th century might have had access to texts describing plant remedies dating back to ancient Greece and Rome, combined with local folk knowledge. Combined with their own clinical observations treating sick and injured people year after year, they understood that certain plants reduced swelling, others stopped bleeding, others prevented wounds from becoming foul and gangrenous. They didn't know why these treatments worked biochemically, but they knew that they worked. And that practical knowledge was often remarkably accurate. Modern research has confirmed the biological activity of numerous medieval medicinal plants. Yarrow contains compounds that promote blood clotting and have antimicrobial properties. Plantain leaves contain allantoin, which accelerates wound healing and tissue repair. Honey has been proven to have powerful antibacterial effects that can outperform modern wound dressings in certain clinical applications. These weren't magical beliefs. They were functional medicines that genuinely healed injuries. So what exactly was medieval herbal medicine? First, understand that herbs weren't alternative medicine to medieval people. They were simply medicine, the primary way that injuries and illnesses were treated across all levels of society. Every village had someone with knowledge of healing plants. Every monastery maintained gardens specifically for medicinal herbs. Every household knew basic remedies passed down through family lines. Herbal medicine wasn't something you chose instead of real medicine. It was the real medicine, and it operated through several practical forms. Poultices were thick pastes made from crushed fresh or dried herbs, applied directly to wounds, swellings, or painful areas. The plant material would be mashed, sometimes mixed with water, wine, or animal fat, and packed onto the affected area. This allowed the active compounds in the herbs to absorb directly into damaged tissue. Salves were herb-infused fats or oils that could be applied to skin. Herbs would be simmered slowly in animal fat, olive oil, or butter, extracting their medicinal compounds into a spreadable form. These provided a protective barrier while delivering healing substances over extended periods. Tinctures were made by soaking herbs in alcohol or vinegar for weeks, extracting concentrated plant compounds into liquid form. These could be taken internally or applied to wounds. Infusions, essentially medicinal teas, delivered plant compounds through drinking. Certain herbs were known to reduce fever, ease pain, calm the mind, or support the body's recovery from inside. But here's what made medieval herbal medicine fundamentally different from modern pharmaceutical approaches. Medieval remedies didn't just target symptoms, they supported entire systems. When a medieval healer treated a wound, they weren't just trying to stop the bleeding or numb the pain. They were creating conditions for the body to repair itself completely. They applied herbs that reduced harmful inflammation while preserving the beneficial inflammation needed for healing. They used remedies that improved blood circulation to the injured area. They supported the body's immune response rather than suppressing it. They promoted tissue regeneration at the cellular level. The goal wasn't to make symptoms disappear. The goal was complete recovery. And this is precisely where modern medicine has gone wrong. Consider what happens when you take a standard painkiller for an injury today. The drug blocks pain signals from reaching your brain. You feel better immediately. The discomfort fades. You can function normally, or at least you think you can. But pain exists for a reason. Pain tells you something is damaged. Pain forces you to rest the injured area. Pain prevents you from making the injury worse through continued use. Pain is the body's way of demanding attention for something that needs healing. When you silence pain artificially, You remove this protective signal. You continue using the damaged tissue. You delay or disrupt the healing process. You feel better while actually getting worse. Now consider modern anti-inflammatory drugs. Inflammation has become the enemy in modern medicine. We treat it as purely negative, something to be eliminated as quickly as possible. Doctors prescribe anti-inflammatories almost reflexively for any injury or chronic condition. But inflammation is not your enemy. Inflammation is your body's primary healing mechanism. When tissue is damaged, inflammation brings immune cells to the area. It increases blood flow, delivering nutrients and oxygen needed for repair. It clears out damaged cells and debris. It initiates the complex cascade of tissue regeneration. Yes, inflammation causes swelling. Yes, it causes redness and heat. Yes, it causes discomfort. But these are signs of healing in progress, not problems to be eliminated. When you take anti-inflammatory drugs, you suppress this entire process. The swelling goes down. The discomfort fades. You feel like you're healing faster, but you're actually healing slower, and often incompletely. Studies have shown that anti-inflammatory medications can delay bone healing, impair muscle repair, and reduce the strength of healed tissue. The very drugs prescribed to help you recover may be preventing full recovery. This is the fundamental problem with symptom-focused medicine. It optimizes for how you feel right now, not for how well you actually heal. Medieval herbal medicine operated on completely different principles. Rather than blocking the body's healing signals, medieval remedies supported and enhanced them. They worked with biological processes instead of overriding them. Let me show you exactly how this worked with specific examples. Consider wound care. When a medieval healer dressed a wound, they often used 3 key ingredients: honey, yarrow, and plantain. Honey wasn't just folk tradition. Modern research has revealed that raw honey contains hydrogen peroxide, which provides gentle antibacterial action. It maintains a moist wound environment that promotes faster healing. Its high sugar content draws fluid from bacterial cells through osmosis, killing them without damaging human tissue. Certain types of honey, like Manuka honey, are now used in clinical wound care because they outperform synthetic alternatives. Medieval healers didn't know the chemistry, but they knew wounds dressed with honey healed cleanly and rarely became infected. Yarrow, called soldier's woundwort in medieval times, was applied to stop bleeding on battlefields and in farming accidents across Europe. Modern analysis reveals yarrow contains acylane and other compounds that promote blood clotting. It also has anti-inflammatory and antimicrobial properties. It was so effective that variations of yarrow treatment appear in medical traditions, from ancient Greece through medieval Europe and into Native American practices. Plantain leaves, the common weed you've probably walked past 1,000 times, contain allantoin, a compound that accelerates cell regeneration and tissue repair. They also contain aucubin, which provides antimicrobial effects. Medieval healers crushed fresh plantain and applied it directly to wounds, insect bites, and skin infections. These 3 ingredients together created something remarkable. They controlled bleeding, they prevented infection, they reduced harmful inflammation while supporting beneficial healing processes. They promoted tissue regeneration. They created a protective environment where the body could do its work. And they did all this without suppressing the body's natural signals. Consider infection control. Before antibiotics, infection was the great killer. A simple wound could turn septic and kill within days. This is the primary argument for modern medicine's superiority. But medieval healers had effective strategies for preventing and treating infection that we've largely forgotten. Garlic was used extensively for its antimicrobial properties. Modern research confirms that allicin, the compound released when garlic is crushed, has broad-spectrum antibacterial, antiviral, and antifungal activity. Some studies show garlic extracts effective against antibiotic-resistant bacteria. Wine was used to clean wounds. The alcohol content provided disinfection, while the polyphenols in wine have additional antimicrobial properties. This wasn't superstition, it was practical chemistry. Thyme, oregano, and other aromatic herbs contain essential oils with powerful antimicrobial effects. Thymol, the active compound in thyme, is still used in modern mouthwashes and antiseptics. Medieval healers didn't know about bacteria, but their treatments killed bacteria effectively. Now consider inflammation, but handled very differently than modern approaches. Medieval remedies for swelling and pain often came from willow bark, meadowsweet, and similar plants. These contain salicylates, the natural compounds that inspired the development of aspirin. But here's the critical difference. When you take aspirin, or ibuprofen, you get a concentrated dose of isolated compounds that powerfully suppress inflammation throughout your body. When medieval people consumed willow bark tea, they received salicylates along with dozens of other plant compounds. These additional compounds modulated the effect, providing pain relief and reducing excessive inflammation while preserving beneficial inflammatory processes. Modern pharmaceutical, isolated compound, maximum suppression, systemic effects. Medieval remedy, complex plant matrix, modulated effect, targeted support. The outcomes were fundamentally different. So if medieval herbal medicine was this effective, why did we abandon it? The answer has nothing to do with whether these treatments worked. It has everything to do with industrialization, standardization, and profit. When medicine became an industry in the 19th and 20th centuries, everything changed. Pharmaceutical companies needed products they could manufacture at scale. They needed consistency, the same pill producing the same effect every time. They needed patentable formulations that could generate profit. Herbal medicine couldn't provide any of this. Plants vary in potency depending on where they grow, when they're harvested, and how they're prepared. You can't patent a plant that grows wild in every meadow. You can't mass-produce remedies that require skilled preparation and local knowledge. So the pharmaceutical industry did something clever. They isolated the active compounds from medicinal plants. They synthesized these compounds in laboratories. They concentrated them into standardized doses. They packaged them into pills and marketed them as superior to the crude plant remedies of the past. Aspirin came from willow bark and meadowsweet. Digoxin came from foxglove. Morphine came from poppies. Many foundational pharmaceutical drugs originated in traditional plant medicine, but something essential was lost in the translation. When you isolate a single compound from a complex plant, you remove all the supporting compounds that modulated its effects. You create something more powerful, but less balanced. More predictable, but less harmonious with the body's systems. The medicine became a product instead of a process, and healing became something done to you rather than something supported within you. Look around at modern health outcomes, and you'll see the consequences everywhere. Chronic inflammation has become epidemic. Conditions ending in ETS, arthritis, tendinitis, bursitis, colitis affect millions of people permanently. We manage these conditions with ongoing medication rather than resolving them. Injuries that should heal completely instead linger for months or years. People accept chronic pain as normal. They're told that some damage simply never fully repairs. Dependency on medication has become standard. People take daily pills for conditions that previous generations resolved through recovery. The goal shifts from healing to management. Recovery protocols grow longer and more complex while outcomes often remain incomplete. We've created a medical system that excels at keeping people alive but struggles to make them truly well. This is not an attack on modern medicine. Emergency care, surgical intervention, diagnostic technology, these represent genuine advances that save lives daily. But somewhere along the way, we lost the understanding that healing is a process the body performs, not a product you consume. Medieval medicine understood this intuitively. Healers saw their role as supporting the body's inherent healing capacity. They created conditions where recovery could happen naturally. They worked with biological processes rather than overriding them. Modern medicine often sees the body as a machine to be fixed from outside. Symptoms are problems to be eliminated. The body's own responses, pain, inflammation, fever, are treated as malfunctions rather than healing mechanisms. This is the crucial distinction. Medieval medicine was not better than modern medicine in absolute terms. It couldn't perform surgery. It couldn't treat severe bacterial infections as reliably as antibiotics. It couldn't manage acute emergencies with the precision we have today. But medieval medicine was complete in ways modern medicine is not. It addressed the whole system, not just isolated symptoms. It supported recovery rather than suppressing signals. It created lasting healing rather than ongoing management. So what can we actually learn from this? I'm not going to tell you to abandon your doctor or throw away your medications. That would be irresponsible and potentially dangerous. But I will suggest some principles worth considering. Healing requires time. Real tissue repair cannot be rushed. Our ancestors understood that recovery meant rest, patience, and allowing the body to complete its work. Modern expectations of instant recovery often interfere with this natural timeline. Healing requires environment. The conditions surrounding an injury matter enormously. Nutrition, sleep, stress levels, circulation, all affect how completely you recover. Medieval healers created healing environments. Modern medicine often ignores everything except the specific injury. Symptoms are information, not enemies. Pain tells you something needs attention. Inflammation indicates healing in progress. Fever shows the immune system fighting. Before suppressing these responses, consider what they're trying to accomplish. The body knows how to heal. Given proper support, human tissue has remarkable regenerative capacity. Our role should be supporting this process, not overriding it with powerful interventions at the first sign of discomfort. Simple remedies still work. Many medicinal plants available to medieval healers grow in your backyard or local health store. Their effects are documented in modern research. They remain options worth understanding, even alongside conventional treatment. None of this means rejecting modern medicine. It means questioning whether our current approach is as complete as it could be. It means recognizing that something valuable was lost when healing became an industry. And it means considering that our ancestors, working without laboratories, without microscopes, without any understanding of cellular biology, sometimes achieved outcomes we still struggle to match today. Here's the question I want to leave you with. If medieval people could heal serious injuries with plants, patience, and practical wisdom, if their wounds closed cleanly, their bones set strongly, and their bodies recovered completely, what does it say about progress that we so often cannot? What did we trade away when we decided that faster was better than complete? What might we regain if we remembered that healing is not a product you buy, but a process you support? These are questions worth sitting with. In the next video, we'll explore another piece of forgotten knowledge: how medieval people used food itself as medicine, how everyday meals were designed to prevent illness before it started, and why the separation of kitchen and pharmacy may be one of the costliest mistakes modern society has made. Thank you for watching this video. If you found value in this exploration of medieval healing wisdom, please take a moment to like this video and subscribe to the Medieval Advantage channel. Your support helps us continue researching and sharing this forgotten knowledge with those who need it most. I'll see you in the next one.